Good afternoon, North Dakota. Welcome to today's press briefing. Today, the North Dakota Department of Health confirmed 46 new cases of the coronavirus disease, COVID-19, out of 638 tests that were delivered. I'm sure those that have been following this closely, as many of you have, recognize that this is our largest single day of new cases by a significant amount. From a percentage increase day over day, it's one of our largest percentage day increases. And this brings our confirmed rate for today to 7.2%. That's in the upper right-hand corner of the slide. That's the fourth day in a row that we've had a three of the last 4 days we've had a higher than 7% on new positives. And that would be the number of positives divided over by the total number of tests taken. 638 tests taken yesterday, which is an improvement, still not as high as we'd like to see it, but that's going up. That's good. But the 7.2% is the same as yesterday's, and that's the three of the last 4 days we've had a positive test rate north of 7%. Those higher days then are moving our cumulative state rate to 3.6% is where we are right now, which is still we're the second lowest. We've dropped below Alaska, so Hawaii and Alaska are ahead of us, but now we're the third lowest in the nation, which is good news. We're still in the same category there of being among the lowest in the nation in positives, but we are paying close attention to that increase in the daily rate of the 7.2%. But part of that, which we would expect to see, is a higher percent of positives each day because of our targeted testing. When we have found an outbreak now, whether it's in a commercial sector or in a nursing home, we're coming in with our rapid response team, testing in a more targeted way all the people that are around those initial positive cases. And so in some ways you could say we're looking for positives, because when we're out looking for positives, then that is good news, because then we can get people treatment sooner, we can quarantine them and their other household members appropriately, and it's a way that we can stop the spread in a targeted fashion versus in the general approach that has been taken during this pandemic across the country. 18 of today's 46 cases were under the age of 40, which is again a reminder for everybody out here that while this disease is deadly for those that are elderly and with underlying health conditions, people of any age can contract this COVID-19, and it's one of those cases is under the age of 10 and another is under the age of 20. On the other thing to point out on this next slide is that, again, we've got currently 16 people that are hospitalized. That's up over the previous days, but still relatively and quite low relative to our overall hospital capacity, so we're in good shape there. In terms of the newly recovered cases, we had 9, but then a net 37 is also our largest single increase day in terms of active cases, and that shows up on the top of this next slide, where you see the big jump there in the bar going up because the new positives of 46 outweighed the recoveries of 9. The next slide we're going to take a look at is positive case rate by county. Again, here you see this 3.6 for the state average, but we get to that average, which is the average across all of the counties that have cases. We have 22 counties that have no cases at all. There's 53 counties in North Dakota, so of the 31 counties, some are lower, some are higher. The darker on this chart means a higher rate. As you see, again, our highest rates as a percentage of positives by county continue to be in the northwestern part of the state, and our most populous county, Cass County, they're at 6.5%, about the same as Montreal. Montreal was a higher percentage earlier when we'd done limited testing, but after the large amount of testing we've done up there, we've produced a lot of negatives, which is good news, helps us understand the situation. They start to fall in line. And so again, with broader testing, these numbers probably start to aggregate closer together. In Grand Forks, which had been among our largest cities having the lowest accounts, is starting to climb. They're at 3.1, so they're coming closer to what the state average was, and part of managing that small hotspot we had up in Grand Forks. So with that, we want to talk a little bit about opening up again, and we talked about that on Wednesday, but I want to remind people, as we think about that step-by-step plan for reopening, we had a number of criteria that we shared on Wednesday, which still stands, and that our restart was not driven by a date, even though our executive orders expire on April 30th. We're going to be driven by data, not by the calendar, because the virus has no awareness of the calendar that we use, and so we have to stick with the data as we said we were. But we also said there's criteria that we want to make sure we have, which is robust, widespread testing capacity. We continue to build that up. You'll hear more about that next week. Robust contract tracing and infrastructure, making great progress. We'll keep working on that all weekend. You'll hear more about that next week. The targeted effective isolation and quarantine, which we're implementing right now when we find positives in the executive orders we have out about positives in their family members. Protections for our state's most vulnerable population. This is another topic for next week, where we're going to be talking about everything that we're doing relative to securing and caring for those that are in long-term care situations or other congregate living situation. The fifth thing, which we really nailed this week with the surge plan, the sufficient healthcare capacity, including hospital and ICU beds. That one we've got covered and checked off. Available PPE for the healthcare system and the public. We're in good shape today, and that's getting better over time. New standard operating procedures for reopening. The economic resilience team is working on that. And then, of course, plans for dealing with the resurgence or additional waves of COVID-19, whether that's this summer, next fall, next winter. We've talked about that again, historically, when you've got something this contagious, it doesn't just go away. It can come back, and we have to be ready for that. So we're continuing to work on that. Yesterday, at the federal level, they released guidelines about opening up America again. There was 6 criteria in how to open up, and really there was six criteria. There are 2 sets and 3 sets of 2. 2 of them were and, 1 was or. The or one relates to the numbers we've shared a lot here, which is are your case counts going down, or is your rolling 14 average going down? And so we're sharing a slide today that we haven't shared in the past. We've shared our rolling average relative to when this began versus the rolling average of the last 14 days. And so we'll start sharing the rolling average last 14 days, because this is one of the federal guidelines that either your case counts are going down or your rolling average is going down. And as you learned today, our rolling average is going up and our case counts are going up. So we are, we continue to prepare for a smart restart. As we had said when we announced the extensions on Wednesday, that we thought that we might be heading into the increasing part of our curve, because we're at a different point in dealing with the contagion than other parts of the country. That turned out to be at least prophetic on a two-day notice from Wednesday to Friday, because on Wednesday we did not know that we were going to have our largest and then our next largest day in the following 2 days, but we knew it was a distinct possibility, and we talked about it because we were coming out of the low testing numbers that had occurred over Easter. But again, we'll keep tracking the numbers. But a reason we're sharing this, because I know there's so much optimism, which I share, about our ability to have the smart restart. But to be able to do that, we have to continue to be, before we get to the North Dakota Smart Restart, we've got to continue to be North Dakota Smart. And that means we got to continue with, even no matter how much optimism that one might hold about our ability to get back more to the new normal, we have to make sure to understand the reason why we had low numbers and the low spread and the good results was because we had such high compliance relative to individual responsibility. And it's also important to reiterate too that because we're getting a lot of quests about when people can reopen from people that we never mandated they closed. And so again, want to reiterate to the public, if you're someone who's just come back from another state, or if you're watching national versus local news, all aspects of ag, all aspects of healthcare, all aspects of the energy sector, there was no mandatory closures for any of those sectors. And if they want to be open and running today as they are, they're free to do so using their COVID etiquette. Education, which is another big chunk of our economy, our K-12 schools are running and doing a fantastic job with distance learning, and our universities are all operating with online learning. And so education, energy, healthcare, and ag, our four biggest industries, are all still open for business. We did have the targeted closings, which we've talked about: bars, restaurants, gyms, theaters, and personal care businesses. Those should start their own planning for how they plan to open up, applying the new etiquette. But again, under the North Dakota SMART piece of this thing, that activity that we have, that we've talked about in the past, whether it's personal hygiene, whether it's reducing essential travel, whether it's maintaining your distance, wearing a mask if you're not able to maintain distance. We want to make sure that we continue to apply all of the North Dakota SMART activities while we're heading towards the North Dakota SMART reopening. Next topic we want to talk about is actually nursing homes, and as has been reported in the media, we have had some breakouts. We're fortunate that we've had fewer than virtually any other state. We have 9 of our 218 facilities that, as of this morning, had reported either one staff member or one resident that had tested positive. We have had an outbreak at Eventide Senior Living in communities in Fargo, and this has already been reported, so we're sharing it here. 13 individuals there have tested positive for COVID-19. Our long-term rapid response team, or long-term care rapid response team, met with Eventide Director of Nursing, their administration, infection preventiveness yesterday, and Eventide's been actively engaged and is taking action against this. And so we know that this is a high priority for us, and we're going to continue to drive hard. We had a strategic meeting earlier today to talk about how can we amp up the resources to protect all those that are in long-term care facilities, and we appreciate the collaboration we've had with the Long-Term Care Association and the individual administrators, but we'll look forward to expanding that collaboration going forward, because as we think about reopening, we've got one of our list of our 8 criteria was making sure that we could protect those that were most vulnerable. So we are going to continue to pour energy into that, and you'll hear more about that going forward. Next topic is we did sign one executive order today, and this relates to, again, cutting more red tape. At the beginning of this COVID-19 emergency, the North Dakota Department of Human Services reacted quickly, and they requested several flexibilities from the CMS, or the Centers for Medicare and Medicaid Services. These requests were approved by CMS recently, and they allowed us to get services to beneficiaries quicker, allowed providers to enroll in a more streamlined fashion, to allow to pay close attention to the needs of vulnerable populations, such as Medicaid members that may have been dealing with intellectual disabilities, the elderly, or individuals with physical disabilities who are receiving care in their homes, or children with medically complex conditions. And these Medicaid programs are governed by many federal and state laws. When the feds change their rules, this executive order suspends the state laws on the state side that must also be waived to allow us to adopt the flexibility that we requested and received from CMS. And this includes this includes all citizens in North Dakota that are covered underneath this. So anyway, thank you again to DHS for them acting quickly. Thank you to SEMA Verma and CMS at the federal level for responding to our request. And we've got questions on this. Chris Jones is here from Department of Human Services to answer questions. We have a quick, short readout. Had a great call this morning with Labor Secretary Eugene Scalia. We talked about unemployment insurance. We talked about what's going on in the oil industry. We talked about recovery and North Dakota Smart Restart and reopening America again, and had a great conversation. But again, another action that indicates the federal government's strong partnership with those of us here in North Dakota. And again, earlier today, Senator Hoeven and the GNDC held a business briefing with a number of folks across the state dialing in, but also included representatives from the SBA and from FEMA and our own Brian Klipfel from Job Service ND and from Workforce Safety. But want to give a shout out and thank those federal partners, including Labor Secretary Scalia, Senator Hoeven, and others for keeping everybody informed about everything that's going on the economic recovery side. Yesterday there was a question that has come in a couple of times online about whether we would release zip code data. I said yesterday we'd sure take a look at whether or not we could do that if we weren't violating any privacy laws. Having taken a look at this more deeply, we've made a decision that as of today we're still not going to be releasing zip code data. The challenge is that we have in our thinly populated states, when we have some counties that have only one or two individuals, we've already released to the public their age, their gender, and their county. If we also release the zip code, in some cases we may be effectively sharing with the world who this individual is, and they've got a right to their private health data. If we were in a state like Florida, which I know has got it all on a website, where you've got, when you get tens of thousands of cases and lots of people per zip code, then that could be possible. Maybe when this is all done, it can be analyzed that way, or maybe when we get above a threshold where you have 10 or more cases per zip code, or if we stopped releasing, age and gender, we could give out zip code instead of age, gender, and county. Could be another way to help protect people. But right now, given that we've given those positive identifiers of age and gender and county already, we're going to hold back in an effort to protect people's privacy and not release the zip code data. The whole point of having zip code data is trying to figure out is if it's in your community. But we, again, practicing the physical distancing, we should just assume that COVID-19 is everywhere because there's no county in North Dakota which doesn't have people that travel to counties that do have positive cases. That travel is happening every day, whether it's for commuting, whether it's someone delivering supplies on a truck. I mean, there's movement going across our state. There are no gated communities, so to speak, or gated counties or gated zip codes. And so it's best for everyone just to apply the North Dakota Smart approach and assume that it is there. And if you assume it's there and act appropriately, maybe it won't show up. That'd be the best way to have it happen. Quick update on contact tracing. In addition to greater testing capacity, contact tracing is still really critical, and it's one of the criteria that we have. As I said, you'll hear more about this next week, but I do want to give a shout out to our local public health team members who have jumped in and are working tirelessly with North Dakota Health. Also, we've pulled in new team members, including those from NDSU Nursing and others that are helping on contact tracing. But it's been largely in the past a manual, time and labor intensive process, and we're working and without the tireless effort of all those folks, we've not been able to complete this critical task. But especially as our numbers go up and we have a desire to reopen and we have to have targeted contact tracing, we need to bring some technology into that, and we're making some efforts to build out a back-end database that would have an implemented automated solution for contact tracing with support from North Dakota Health, support from Microsoft, and support from North Dakota Department of IT, NDIT. We'll begin to launch and learn this, and this is a system which I know that if we get it going here, there may be other states that will be very interested in this as well. And then on CARE 19 update, which relates to this, which is another element separate from the back-end database, we've got 18,500 participants, so that continues to climb. If you've downloaded it, thank you. If you're waiting for Android, it's been submitted to Google and waiting approval by Google and for the Android app. And that concludes the contact tracing. We'll have a deeper and bigger update on that next week, but again, making good progress there. Unemployment stats for today. Thursday, the regular claims, again, trending a little bit lower than what they were at our peak, 1,329 regular claims. The pandemic unemployment assistance way down to 210, which I take that as a good thing. Pandemic emergency unemployment compensation claims down to 260. So then again, that brings the overall totals since March 16th, 53,773, PUA 6453, PEUC 6627. Updates on the money flowing, which is always people are interested in, of course, but Job Service, as we announced on Wednesday, began dispersing the $600 pandemic unemployment compensation claims payments. Those 600, that's 600 on top of what they would have been paid before. Anyone who was certified their eligibility on or after April 14th has had the 600 payment added to their weekly benefit this week. The payment will continue to be automatically added to each individual's weekly benefit up to July 31st this summer. We've already paid over $2.2 million out in North Dakota in those $600 payments in this week alone. So that's money flowing to people that were affected by the pandemic. We're happy that's out there. But note on taxes, we said this was tax week and we didn't have to pay taxes, but it turns out that $600 payment is taxable. And if the individual has chosen to have taxes withheld or has child support withholding, they will see their amount of their check reduced to something less than $600. Individuals should keep in mind that if they choose not to have taxes withheld, they should know that addition of $600 a week could result in higher tax liability depending on your other income. For those North Dakotans who were certified their weekly eligibility between March 29th and April 14th, we are still working on finalizing the changes in the code required to pay back weeks of FPUC. And for those that are more interested in this, and a special shout out to all the legislators, we need funding to replace the mainframe that has been kept alive and keeping the unemployment going. The team over there has done a masterful job of keeping that going, but as I've said, when that mainframe is done, we should move it to the Heritage Center and put it next to the dinosaur exhibit. So it is we will be happy to see that replaced after we get through this. Next topic, a behavioral health update. The SAMHSA, which some of you may have heard of, Substance Abuse and Mental Health Services Administration, recently announced emergency grants to help Americans dealing with substance use disorders and or serious mental illness. You know that this has been a big focus here at the state of North Dakota between our behavioral health team, great support from the legislature, and great work by the First Lady in her platform and her work. But we're excited today that the North Dakota Department of Human Services behavioral health team was awarded a $2 million emergency behavioral health grant to address the behavioral health crisis, mental and substance abuse disorder, and other related supports for individuals that are impacted by COVID-19. We have included every single day a behavioral health update from as part of these briefings, because we understand that behavioral health is also like physical health, part of our total health picture, and we also understand that the isolation and financial stress associated with this both health emergency and financial crisis for many is creating additional challenges. So again, way to go, the Human Services team, Behavioral Health Division, for getting this grant. It's specifically designed to address the needs of all these individuals, and individuals with substance use disorders, individuals with co-occurring mental illness and substance use disorders. So really welcomed federal support. And this During the 16-month grant period, Behavioral Health Division will be working with public and private partners to implement the needed services across the state. So great news there on that $2 million grant. Safe Kids tip, this is our next section. One of the things I want to say that is important as we've got so many kids at home, they're out of their regular routine, and people are challenged, I'm sure, as parents with kids of all ages at home, but sadly the #1 cause of death for children remains preventable injuries, not disease. And so as we are focused on COVID, we need to make sure to continue to make sure providing safe environments for folks and for the little people in our lives. Historically, the 100 most dangerous days of the year for children fall in the summer months when children are out of school in a less structured environment. Schools are closed and some of these children may be in a less structured environment. So normally these tips would come out in early June to remind parents, but helpful to get them out now. Obviously, there are a lot of focus right now on hand sanitizer, disinfecting wipe, medications, and those things around the house. These are dangerous, when consumed because of the high alcohol component of these. It will and right now, if those are out and available for toddlers, these could be dangerous. You can't watch your children every minute of the day, so it only takes a moment for kids to get into medications or other potentially dangerous substances. So remember to keep these items secure and out of the reach. Should be locking cupboards and drawers containing dangerous items, whether they're medication, laundry pods, things that look too much like candy that might go into a dishwasher, the soap things, all those things that somebody might try to consume. If you need cabinet locks or assistance, you can contact Safe Kids Grand Forks at safekids@alltrue.org. They'll provide those free of charge in case of emergency. The Poison Control Center number, have it in your phone, have it ready around your house, 1-800-222-1222. The calls are free. They're staffed 24 hours a day. They're there to assist. And again, other tips for parents: designate a safe play area for young children that's free of choking hazards, free of unlatched windows that could pose a fall hazard, or stairways that could be dangerous if climbed unattended. And then set outside play boundaries. Be aware that the dangers that may have accumulated this time of year. There's always a danger in the springtime in North Dakota that you might have ditches or low areas that accumulate water that could be dangerous. And again, kids are curious by nature, which is a great thing, but they tend to be drawn to water, and so keep that in mind. And when you venture outside with your children, remember that COVID-19 can live on surfaces. We've talked about this before, that if you've got public playgrounds or other public services that may not be sanitized regularly, bring along your disinfectant, practice good social distancing. And again, there are Safe Kids coalitions found in Grand Forks, Bismarck, Mandan, Fargo, Minot. We want to thank all the volunteers that work with those organizations that work to keep our kids safe here in the state. Closing for today is of our formal section is in the good news section. North Dakota, we have many assets. One of those we'd like to highlight today is the North Dakota Mill and Elevator. North Dakota is the only state in the nation with its own mill and elevator, and it's the largest single mill in the U.S. and Canada right now, and with a capacity to produce 52,500 hundredweight per day. If you've probably haven't had a chance to tour it, I have, along with the rest of the Industrial Commission members, and it is a fantastic modern facility doing fantastic work and shipping great products around the world. But the mill has stepped up, as they have over the course of its 100-year history, to help North Dakotans, and the mill has stepped forward to donate 40,000 pounds of flour to help support North Dakotans who may be struggling right now with nutritional needs during this downturn. That will be distributed through food banks and through tribal nations. 1,000 5-pound bags were donated to Spirit Lake Nation, an additional 3,000 5-pound bags to the Great Plains Food Bank, and Each of the other 4 tribal nations with whom we share geography will also receive 1,000 5-pound bags in the coming day. The Great Plains Food Bank, as some of you may know, is the only food bank in North Dakota that acts as sort of the distribution hub, and what they received will be distributed to over 100 local food pantries around the state. And of course, flour is made from wheat, which is grown in North Dakota and ground at the state mill, be coming right back to feeding those citizens in need. But we're grateful to Vance Taylor, who's the president general manager of the mill, and his whole team, and all the work that his great team does up there to make this possible. Thank you, Vance, and thank you all of the great team members at the North Dakota mill. In closing, I want to say on the gratitude thing, before we go to this, I want to just say thanks to everybody who's standing up and showing up for somebody else, whether that's a family member, whether it's a neighbor, whether it's for a coworker. There's a lot of people that during this crisis, as they say it, crises like this don't necessarily form character, they reveal character, and there's a lot of you that have shown up for other people. Max Lucado had a statement that said that people who make a difference are not the ones with the credentials, but the ones with a concern. And we know that as you show that concern, show that caring, show that love for your neighbors and for your coworkers, it's really making a difference. And again, you've heard me share this before. I know it's one of the hardest things in the world sometimes to get in the habit of sharing gratitude by writing a note. But I ran across this quote the other day from William Arthur Ward. I didn't pick it just because he's got a great middle name. I picked it because it says, "The feeling gratitude and not expressing it is like wrapping a present and not giving it." And so if you're feeling gratitude for someone that touched you in your life, you've already wrapped that present. Take the time to give it away and send them a note or a card or give them a call or a text or something, and make sure they know that you appreciate what they've done, because gratitude builds resilience, and resilience will help us get through this crisis, whether it's health or economic. It's one of the things that'll get us through, and get us through in a North Dakota smart way. With that, I'll stand for questions. Going with Lane this time. I'm bending my hard left turn there. I don't know what I do at the beginning of these things, but thank you for being here every day.
Governor, with today's spike in numbers, are we still on the same path of the curve that you were expecting?
Well, actually, with the spike, with the number, our biggest day of the year yesterday at 28, and then the biggest day today at 46, we're in that point of the curve that's the hardest to project, which is when do you start going up. We didn't quite double today, but almost every other state has experienced a time when cases have doubled. This is the closest we've come to that once our numbers have come up. And we had a couple days early on when we went from 5 to 12, but numbers bounce around a lot in the early days because we had so little testing going on. So yeah, I'd say we're where we said on Wednesday that we thought we might be entering the curve, and I would say today we might be entering that part where we're in the steep upward part of it. But the way we have it not get so steep is the work that we're doing with the rapid response teams. When we find these outbreaks, then we can get in there with the testing. We're going to see our positives go up. But if we're isolating all those folks because the people are getting it because of close contact with another person, then we're actually stopping community spread because we're doing a great job of identifying and isolating. And if 100% of our numbers was close contacts, we'd feel like we were in pretty good shape because then we know where it's coming from, we know how they got it, and we know who to isolate. Versus, earlier on we had many days that had community spread. Now we've got the ability to be more targeted, which is, so again, it's a combination of numbers going up, but our ability to match that with resources. And I'd say I feel like we're in pretty good shape right now, but it is important that everybody keep following the North Dakota SMART guidelines because cases are going up. People are focused on reopening, but cases are still going up. I'm going to go online, and then we'll come over to the usual starting three over here. We'll come going online first.
Robin Travers, 660KYZ in Williston. There have been protests nationwide of people who believe sheltering in place and closing businesses are a violation of rights. A group is planning to protest Monday in Bismarck. What are your thoughts on this?
I think that it's one of the great things about America is freedom of speech, and so welcome the opportunity, and we certainly get an opportunity in our office to experience freedom of speech every day, because we hear from lots of citizens from both sides of this equation all the time, and I think it's a fantastic thing about America. So if they are protesting on Monday, we would just ask that if that is a group larger than 10, and whether 10 or smaller, 10 or larger, practice good, safe distancing while you're doing that protesting, and be grateful that we live in a country that honors freedom of speech. I think it's a great thing. Okay, who's first over here? Did you guys decide? Okay, deferring to Jack Dura, Bismarck Tribune.
638 tests in one day is the largest single day of testing up till this point. And you also mentioned a new back-end system for contact tracing. We're kind of ramping up our testing as well while the curve is going up. So these two things kind of go hand in hand, wouldn't you say?
Absolutely.
Yeah.
And as I said yesterday, I mean, we would like to get above 1,000 a day in capacity and then grow from there. We've got new machines coming on, old machines being repaired, new ones being installed. We've got to ramp up our testing. Again, I encouraged people yesterday, I would say that again. We want to not have anybody, if people have got symptoms and they're symptomatic and want to get tested, there are enough test kits in North Dakota to be tested. So we want to encourage all the providers to increase their testing. And if you need more test kits, talk to us at the state. We'll work to get them for you. But there is an ample amount of testing supplies in this country for us to get above 1,000 a day, and we should absolutely positively be there. I mean, on our testing per capita, we were always at number 9. We've dropped to number 11 on that, and so that's not encouraging to me. I want to make sure that we stay at least in the top 10. We fell one spot yesterday because the state of Washington found had data cleanup. They came up with 30,000 tests negatives that they hadn't had. They dumped it into their total, and so then that moved them up in a big single day jump of data collection, and then another one we just slipped behind someone. We were barely ahead, but we've got a goal to get and stay in that top 10 of tests per capita, and we need to do that with again expanding the lab capacity at the state level and working with our partners that we've worked with to date, Sanford and Mayo labs, to make sure that we've got good testing capacity. And then we're also we're working on the plan to roll out the point of contact or the point of care testing with the Abbott ID Now. We did receive 15 of those machines, and plans finalized and being rolled out today about how we're going to get those out to labs across the state, and those will add a little additional capacity that it can occur right on a spot as opposed to collect it, send it to a lab, come back again. This is the machine where you can get a test back in under 15 minutes.
Could you talk a bit more about the back-end system for contact tracing?
Yeah, I'd be happy to. Contact tracing has largely been a manual process in the past where you call a phone interview. And again, there's been some confusion. People might think when you say the word contact and tracing, it sounds like that somebody's going to show up at your doorstep. Contact tracing has been around since the very beginning. I mean, there's a fantastic book, if somebody's got extra time to read, about called the Ghost Map. Was one of the first epidemiologists that ever was able to actually solve the source of in the origin of a disease, cholera in this case, in London, by really tracking where people contracted the disease and where they lived and who was dying, and mapping all that. And so really, I mean, through contact tracing is a powerful tool that epidemiologists have to work their way back to figure out the source. But it is generally done by talking to people over the phone, because you're trying to keep the physical distance, and it's done in an interview fashion. But if that interview's done and it's done on a piece of paper, and then the next day, if you have a team of less than 10 people, which is what we've had in the state of North Dakota through HIV, through Ebola, through SARS, a dedicated team of people that really are experts at this, they can manage that. The same person could call the next person back. When you've got 46 cases a day, and if that number gets higher, we want to be talking to each one of those individuals. And that first interview might be an hour and a half long. Well, then they might give you anywhere between 6 and 20 names of people they've been in close contact with. Then you have to call those people. Well, what do you do with all that information? Well, that all needs to go into a centralized database, and then if on day 2, they call back or somebody calls back, you want to be able to go into the database and say, okay, who talked to them yesterday? What did they say? The whole category, this has been around for over 20 years, it's called customer relationship management or CRM software, but virtually every business and every call center has it. And we need to think about actually sort of building out call center type capability where regardless of who you talked to the day before, your information would be in there. As a consumer, you wouldn't have that frustrating experience of, hey, I explained this all to whoever I talked to yesterday, because your information would be in there. And this is all, information that people are voluntarily provide in an effort to protect their friends and family, because it's the information that can be used to protect people who may have been exposed to a deadly disease. So we want to support the people that are doing these interviews. I think at a minimum, I think the early estimate was it could save up to 90 minutes a day, I think, per person. I think having this I could envision that you could be saving many more hours or even a doubling more of that if we get the system up and customized. And I think that when we talk to other states, very few states have it because nobody knew that you're going to have to do contact tracing at this scale. So what we really is, have to create basically a whole new function and a whole set of new capability. The good news is that part of the federal funds that we're receiving can go exactly towards this kind of capability. The federal funds that states are receiving should go to things that are related to COVID, not towards stuff you were doing before. This is a completely new expansion of what we're doing. So we've got the money, we've got the capability, the skills, we've got the right IT partners, and this is going to help increase the productivity so we can have better contact tracing and with higher productivity. That's something we're always looking for. And if we're going to get to mass testing, again, right now we're talking about testing in a few labs, state of North Dakota, Sanford, Mayo. When we're talking about testing next fall, we're going to be talking about companies doing testing, because companies may have the ability to do testing of everybody that goes into their plant on a Monday morning. And if it gets down to $5 a test for those lateral flow tests, this will just be one more line item on somebody's P&L. And in the new normal, businesses will be, what do you spend on healthcare benefits? What do you spend on all the different categories? What do you spend on salaries? What do you spend on this? There will be a line item. What are you spending on testing, or what are you spending on workforce safety, not in sort of slip and fall, but what are you spending on workforce safety relative to protecting your team members? It's going to be part of the way business is done going forward. So testing will become a much more pervasive thing than just what we're seeing at the labs. I mean, the labs will be one portion of that, but there'll be, commercial testing. I mean, I know that even other states have already launched partnerships with companies like CVS, where testing is not happening at clinics, but it might be happening. You might be, hey, I want to get tested. I'll go to my local pharmacist and get it done. Okay, who am I going to? Dave?
Governor, going back to what you mentioned about the $600 being taxed, A, did that catch you by surprise? B, are you having some issues with some of the guidance that's being given?
To say it was new to me, but of course this is a program that's like 3 weeks old, and as when Senator Kramer was here, he had the 880 pages over here. So that was not a line that I read as part of that said that $600 check was taxable. But I think the guidance, some of the guidance of the bill got passed and then the guidance came later. And so in some cases, we're still learning as we go. We're trying to share here publicly as we know it so people can be informed.
Are you getting enough guidance?
Getting enough?
Are you getting enough guidance on how these things are rolling out?
We are not. We're still missing the major piece of guidance that is missing right now is related to the grants that were given to each of the states in terms of what that could be used for. And this is one of the things that it's really a Treasury decision, but something I talked about with Scalia this morning, Secretary Scalia, because right now the guidance is not clear whether or not we could use that to backfill our unemployment insurance or not. And that was one of the specific questions we asked him. Because that number could be, by the end of the year, at current run rates, you could be talking 300 million, 400 million, 500 million that might be needed at the state level for unemployment. And so having that, the federal funding that's already been appropriated to be used for that could make a lot of sense. If there's another way to fill that, then we would find another way to use the funding for the state for COVID-related expenses. But I would argue that if everybody's unemployed related to COVID, that's a COVID-related expense. Jacob?
Governor, in reference to the numbers going up and the number of cases, you said that this is the hardest point in the curve to project, but is there a certain ballpark, or at least what is your office bracing for?
Well, I think that we're done with the bracing part. The bracing part was, let's make sure that we've got enough hospital capacity to be able to provide the highest level of care. And I think we got through that. So, I mean, there's a little bit of a breathe a sigh of release, because, I mean, these numbers could go a long way up from where they are now, and we'd still have plenty of capacity to care for people, and that's the way you manage the mortality of this. And so I'd say that we're through the bracing part. Now we're trying to, everything we're doing now, whether it's protecting the most vulnerable with our long-term care programs, and whether it's the testing or the contact tracing, those are the muscles that we've got to build rapidly and quickly now that would allow us to reopen. Online?
April Baumgarten with the Forum of Fargo-Moorhead. As we get more cases, will North Dakota release total state numbers of how many cases have been found in long-term care facilities? And what about healthcare workers?
April, good question. I'll have to get back to you on that one in terms of the components of what we're releasing or not releasing, but those are all good questions. I'll go online one more and then to Lane.
Chris Larson with AM 1100 The Flag. With cases climbing in long-term care facilities, will you be looking at going into random nursing homes to do testing? And if so, how would you look at rolling that out?
For a question for Chris is on the random testing at nursing homes. Yeah, we're looking at looking at doing more testing. And one of the things we want to test is not just testing inside nursing homes, but it's trying to figure out how do we do testing of the workers that are going in and out, because it's one thing to restrict visitors, but if we've got caregivers that are coming and going, that could be how COVID's getting into the nursing home. So that's one of the things that we're looking really hard at, and how do we manage that? There's other ideas that we have too in terms of providing more support to the facilities, whether that's disinfecting crews, whether that's more assistance with technology in terms of how they manage the flow of goods and people in and out, and then again encouraging that facility managers. Again, I know that this is really hard because we've got to break cultural traditions, but we've got to have separation of workforce, particularly in our larger facilities. You can't have residents, the residents are in separate pods or separate wings, but then if you got a physical therapist or a chaplain that's going back and forth across the whole thing, that's where you could end up with a super spreader in a nursing home. And we've got to really make sure that that we're isolating, and that again may mean that again under the new standard operating procedures that people have to develop is more separation, so that staff may only work with a certain set of patients every day and not with any other patients, and then those staff don't mix with each other like in a worker breakout room. So we've got to figure out a way. I call it the submarine doors, but they've got to figure out a way to cordon off these larger facilities to slow the spread and protect the people that are there. And when people do become positive, then I know that there's, again, culturally, people in these elder care facilities, it's their home. They don't want to move. They're with their stuff. They're within their comfort zone, and it's a lot of stress. It adds stress to people to move, but we have to figure out a way to separate COVID patients from non-COVID patients effectively in isolation, so that we don't end up with the continual spreading. So it is, if you said, what is the thing that people always ask, what's the thing that keeps you awake at night? The thing that I'm spending a lot of time focused on right now is making sure we're putting our energies around protecting our most vulnerable, particularly those in the congregate living facilities. Lane, and then back to this side.
Governor, of our positive cases this week, a lot of them have been in Cass County, and obviously they have a larger population in the out of the entire state. But is there anything else that you guys think might be going on there that could be causing this high amount of positive cases there in Cass County? And is there any fear that they might become a hotspot?
I think the concern about hotspots is in any of our metro areas across the state is two areas. One is where we've got facilities like we saw at LM in Grand Forks, where you have a lot of people working in one building, or B, where people living in long-term care. And I think that the cases in Fargo are sort of twofold. There are a lot of younger folks, which again, if you've got more cases, it's probably not life-threatening, which is a good thing. And then we've got a lot of long-term care facilities. We've got our highest percentage of most number of beds of any county in long-term care also in Cass County. And so that's I say general demographics is how I would say, but I don't, there isn't anything on a per capita basis that right now that makes Fargo stick out versus other locations, as we've shown on the map here today. I mean, percent of positives, we have other counties that are actually higher than Fargo. Dave?
About the mill donations, maybe a two-part question. A, was the mill approached to buy the Great Plains Food Bank or others to make these donations? And B, is this indicative of maybe growing demand on food banks?
It was brought up to us by Chairman Peggy Kavanaugh in the Spirit Lake tribe during our tribal call the other night, was where we first heard about it. And so then we followed up from there and thought it was a great suggestion, and the mill acted very responsively and very quickly to make this donation. Again, with the support of the Industrial Commission, which includes Attorney General Stenjum and Ag Commissioner Goring.
Indicative of growing demand then?
Well, I think you've probably seen the reports that the food banks right now still have supplies, but what's going out this time of year is going out faster than it's coming in, and I'm sure some of that is because maybe drop-offs or donations have gone down, just like they have for all charities. But I would say for anybody out there that can safely, again, if you've got a local food pantry and you've stocked up on everything you can imagine and you don't need it all, keep in mind your local food banks as a potential donation. Okay, we'll go one more. Is that your mic, or do you have a question, or are you telling me one more? Okay, one more. Okay, all right. We'll take the last one from online.
Scott Hennon with WZFG KFYR Radio. What does the updated modeling tell us about North Dakota's peak, and what date is the bottom of the curve forecasted?
Those are moving targets, Scott, and of course any model would get redeveloped after you've got new data points, and the last two data points we have right now is sending our curve in a different direction, which is up, and so as I've avoided in the past, trying to be a crystal ball reader every day here, I'll avoid that again today and just say that we're keeping our eyes on the number, and we have to keep following North Dakota SMART guidelines, and we've got a record number of cases yesterday and today, but part of those are because it's not just the number of cases, it's how we're finding them, and if we're finding them through our rapid response teams and isolating people, that's a good thing, as we're actually out looking for more positives right now, trying to catch them and then contain them. So it is, in some ways, though, if we do have the only way you can have a backslide of a slope is to actually have a peak, and one of the things that I was worried about even earlier in this week was if we were so flat for the whole month, knowing that there had to be a peak sometime, that if the peak was going to come in June, say, for example, it was going to come in June when the whole nation was opened up. So, I mean, if you're going to have a peak, I'd rather have it now. I'd rather have the top of the curve starting now than starting later on this summer, because right now everybody's in good compliance. So we'll happy on a day like today that we've got no deaths. We're happy that we got low hospitalizations, and we're happy that we're making great progress on testing and contact tracing. So in closing, today, to everybody that's here, again, thank you for your important role in helping make sure we get accurate information spread. And again, want to give a shout out as we close the school week. Had a great call this morning with the K-12 Coordinating Council, along with Superintendent Baszler and all the leaders of education, legislators, and teachers from across the state. And there are, and from talking to other governors, I mean, one of the things that I think is one of the great underreported news stories in our nation is the fact that K-12 education in North Dakota is up and running and doing distance learning, because there are other states whose schools are closed and there is no education occurring. But the money's still going out the door, but education's not occurring. And so we're fortunate here in North Dakota to have the education leaders we do, and the teachers on the front line, and those are continuing to invest in themselves and learn new skills. And again, kudos and thanks to all the parents that are helping their kids with homework. Every day is homework day. Thank you for that. Thanks for the teachers that are reinventing their approaches and re-innovating on how they're doing their stuff. But that's another great, good news story, and would look forward to when there's a national story about how North Dakota's education leaders turned this thing around in 12 days and have done some amazing work. So with that, we don't intend to have a press conference tomorrow, or press briefing tomorrow or Sunday. We will be, of course, issuing press releases over the weekend, and of course, if there was an emergency, we would that couldn't wait till Monday, you'd hear from us, and we'd be back. But for those that are out there that are tuning in, thank you for tuning in. Thanks for all your ideas and suggestions. Thanks for your words of encouragement and support. And this weekend looks like we might have a little nicer weather across the state. And so, and you get out and get some fresh air, enjoy a walk, and keep being North Dakota smart. And we're on the right track. So thank you very much. Have a great weekend. And thank you, Lindsay.